we had described the conditions in a certain way, and we give them 1 month to pull their socks up.
Okay.
And within 1 month, we were all shocked with the improvement.
Oh, brilliant.
So we're hoping that this can happen here as well.
Okay.
All right. So basically, first upon my looking around, because usually what we do, we visit.
Right.
That's the first thing we do. And then after we visit, we'll come back to your office and we'll talk about what it is we've seen. And then we'll talk about the way forward.
Right.
And so that's the process we have. So most of these are, members of the press, could you indicate so we have an idea?
Stabrook News, Shipping Sahara.
Romelo, Kaicho.
Kaicho, anybody else? All right, so you have Stabrook and Kaicho for the time being. And all the others are different members of the...
With chest pains, then somebody could have just fallen off some scaffolding that we need to suture up quickly. So you can stabilize the patient with the chest pains and put them for observation whilst the doctor comes to suture up quickly. So it all depends. Timing depends on the nature of the case. And we are in the process of getting some triage forms for us with them. But the RDC has been a little bit delinquent in getting them to us. So by virtue of that, the process has been delayed in getting the triage report.
The triage
forms, yes. It's a special assessment form that we use when patients come in.
How long have you been running that?
About 3 months.
The RDC or the person who is responsible for health in the region?
It's usually channeled through everything channels through the regional executive
That's
officer.
right.
He's the accounting officer.
Okay.
I'm not sure whose fault it will be directly, but last I heard it has passed through the tender board process, but I don't know about if it was communicated to
So this is hampering your
Yes, it
efficiency.
is. It is. Because we're unable to effectively take down patients' vitals and a whole host of information.
Well, we would be very happy if you can be straight up with us, because the intention of this visit is to fix those things
Okay, brilliant.
that are within our purview to make recommendations. All
But
right?
triage forms are extremely
That's
important.
extremely, so we have
Why
that.
it is important also is because we're trying to, please, this is my head nurse Ready to tell.
Hi nurse, how are you?
She's a registered nurse midwife. So yeah. One of the reasons why the triage form is extremely important is we're in the process of setting up a 24 hours triage system. So anybody that would come in, we would be able to assess them from A to Z and determine if they need to go to their patient's clinic or if their case merits immediate attention.
Great.
And
Facilities are in place.
All the oxygen ports are working.
Have you got all your medications?
The only time we will not ordinarily have medication is when MMU is out of stock, and that has
And
been.
how often is that?
As of recent, it has been fairly often. As a matter of fact, even right now, we don't have any glucometer testers. So patients coming in with, let's say, an elevated blood sugar reading, we are unable to effectively attend to
Glucometer?
them. The testing strips.
Okay, thanks. But when you inquired from MMU,
It's a procurement glitch.
oh, is it procurement? Ministry of Health comes under our purview, as well as a number of others. Our responsibility that we can request to visit any institutions, to see what's happening there, to make recommendations, to report to the Parliamentary on what we see with respect to improvement that is required. So we're here. We know that it's a fairly new institution. We know that also nursing is a profession, so sometimes we require it to walk like a mile. We know sometimes it could be a thankless job, and I know that all of us don't have the capacity to be Florence Nightingale. All we are concerned about at the end of the day, the patients who come in here can go back feeling that they would have had a good service. Can we say that patients who come in here feel that way?
Yes.
Do you like what you're doing?
Yes.
Okay. So has that nursing been your vocation, kind of? has nursing been the thing that you wanted to do when? Okay, well that's good because oftentimes people go into areas they don't like and they do a half-hearted, job. But you don't think you have that problem? All right. See, like you just said, thanks to Food for the Poor. These are the kinds of initiatives that we need. All right. So, we want.
As a matter of fact, some of the good initiatives we've had recently is we've gotten an ambulance complement of GBTA. Unfortunately, that was in an accident in February this year, and the other ambulance we had was in an accident last year, in February also. Both of them have been in the workshop, so we're currently out of an ambulance for the past year.
Okay. The question I would want to ask you, and ever so often, what we have discovered, like our recent visit to the two hospitals, we find management at that level of that institution. If the management is good, things you find are okay. So we will also want to ask you at an appropriate time, training, continuous training, because you may come in here as a nurse, but then you have an attitude problem. So, and that will make your institution look bad. So,
as a matter of fact, last year we had a management trainee by here from the Ministry of Health, and we did a course on interpersonal skills for all categories of staff. So we have been doing some sort of internal training from time to time. The nurses have benefited from a number of training initiatives, emergency deliveries, triage training, and a couple of other.
Head nurse, from time to time we've had people, women would be saying that it's our first time that we're having a baby. And a lot of women for the first time are afraid, they're nervous. And sometimes people would say to them, the nurses would say things that I think are negative. Do we have situations like these, or our nurses are so trained to understand you cannot be negative and say, well, when you do this, you didn't scream, you know what I'm talking about.
We don't have
you don't have
no,
that.
no.
We've had a number of complaints where nurses behave in that way, and I think it's uncalled for.
I know.
So I want to encourage you, every time you have your refresher discourse, I'll call it a discourse, you have to remind them about that. That's not professionalism. All right? Okay,
A good initiative from the Ministry of Health recently has been, just like our doctors have continuing professional development, they have continuing nursing development now. So they would address those concerns from time to time. So that's a good initiative.
excellent. All right.
We have surgeries Mondays and Wednesdays for orthopedic surgery. Tuesdays, Fridays is gynae surgery. Thursdays is general surgery.
Sim.
So I see it's busy all week.
You need to teach some others to do that.
The only challenging thing in this country is we have a dryer, but it's not working. The dryer compartment, and it hasn't been working for the past year. The contractors come evaluate and then they never return things.
Okay, I know apart from the amount of energy it consumes.
When the rainy season comes in, it's very challenging.
Alright, this is something we can help with. 1 year ago, the technician came.
Overwhelmed with patients having to be nebulized and stuff. But I think we have adequate stocks of it right now. And of course skin infections, which are so popular by virtue of the little kids running around in dirty places and stuff. I'll take you into the bond now. This is Adivesh. Adivesh is our Cuban pharmacist, and she runs the bond and the key to assist her.
Perception sometimes can be very destructive. This hospital was created to provide, let us say, people coming out of the river, of the East Bank, to be able to come here and to get help. And yes, some people feel that they don't need to come here, we must go to Georgetown Hospital.
Correct.
Georgetown Hospital is always complaining that, you know, our hospital cannot take care of all these persons who are coming from places where there are hospitals such as these. What do you think would have given rise to such a perception?
As a matter of fact, I will say that that perception has changed. It's reflected in our statistics because last year we saw 80,012 patients. So that in itself is an indicative 80,012 patients.
Okay, so let me ask you, have you got a situation where people came here and because of the amount of time that was spent, somebody died in the process?
Again, every case is unique.
It's unique, I understand.
So somebody may have just waited for 5 minutes and collapsed. But in cases where patients would have had to wait for protracted periods, 5-6 hours, before they would have collapsed, I don't think any such case was ever reported.
Okay. All right, I'll hold the next question for later time.
In terms of specialist services, I think the only thing that we're missing here is a pediatrician. Because we have internal medicine. It's not very expensive, it's just bulky. Like infusions and stuff like that.
How much years have these drugs been here?
About 5 years.
And why is it? Okay, I cannot ask you.
We prepared a list, submitted to the Food and Drug Department, but they just need to get an auditor to come and inspect it and give us permission to discard.
And which section of the expired drugs is it? Which section is it?
Albesh, expired drugs.
For those kinds of stuff?
Simvastatin, which is a drug for cholesterol, and some miscellaneous medical supplies.
So these are the drugs here. Come please. Are these all expired? No. All of these here? If you have an equipment here? No.
Yeah, that wasn't commissioned as yet. That's good.
Okay, that's good. So these that are here, but surgeon caps.
No, not those. From
these here.
Yeah.
Okay. We're an organization that is doing good for the people. We're bringing drugs to you. It doesn't matter whether by the time it gets here is a month, you have to dispose of it. They look good in the eyes of the public, and you have to be the storage bond for that.
Yeah, that's
so you have to be alert for the future.
It's a process where the contractor is a little bit slow in executing.
Is it this one alone?
It's along this periphery.
This is reaching again.
Yes. And some of the external problems in terms of fittings, all the civil works are RDC. Like here, for example, this contract was issued a while ago. The contractor has mobilized, but he hasn't completed. His name is Marlon Lal.
Actually?
No, guys, Marlon Lal, yes. Response systems. So the radio antenna is up again. So we're in direct communication with the airport and Georgetown other parts. That's part.
The ambience of this compound, who it comes from?
We've been out of a handyman.
Significant failure for the limb, the spine, and everything about bone, tendon, nerve, laceration. No, I don't have every possibility to roll because sometimes I need some instrument to do surgery in the bone, and I don't have. That's why I can't.
And have you made known your needs to the person in charge, Mr. Banner?
Yes. What has happened? Dr. Leo, his predecessor, Dr. Lilaire, had given me a list, and Dr. Leo had also given me a list, and we have had an allocation in this year's budget for the procurement of additional instrumentation.
When this will happen?
And it's in process right now.
So when we come to check again, we will come back And then we will ask you how long you want us to give you. A month or 2 months so that you can put your house in order. When I say put your house in order, those things that are doable that are in the pipeline, so to speak. So you will have to tell us when.
In the case of the instrumentation, in this case, for example, it's outside of my remit. It's all under the priority of the RDC now.
Well, we will also speak to the RDC about these matters. Creole?
Creole
Do
English.
you know
Creole.
do you Creole English?
Well, it's not real Creole. Well, the real Creole, I learned Creole when I was in Haiti before.
Oh, Haiti, yeah, okay.
I spent 2 years.
But that would be a little French and
Yeah.
French. But do you know?
And Chinese.
Oh, and
Do
Chinese?
you know the Guyanese Creole?
But you know the Guyanese Creole? Because if
Yeah.
I come to you and I don't know English,
I worked before 6 months in Maya,
He worked in Mali for 6 months.
Madia.
along there. So,
Okay, so you know when people you don't have a difficulty with that.
no problem.
Excuse me, Mr. Manna, is it okay if I come back sometime to do an interview with him?
I'll let you know. Guyanese, so it's a little perplexing that way.
I think she looks like somebody I know in Cameroon.
Oh wow.
Eu consegue para a secretaria técnica de Ana.
Okay. How are things here? Do you have all the facilities?
Como estamos aqui, que
Do you have all the facilities that are required for your work here?
No.
What is missing?
Actually, we are waiting on our biochemistry machine and analyzer, which is present at Metatron to be fixed.
Biochemistry machine. And
We're waiting on stains. There's biochemical analyzer. We're waiting on the stains to the CBCs.
when do you expect that to happen?
Well, we don't know when we will get down the
So is it
biochemical
interfering with
analyzer.
the output of here?
Yes, because we will have to take samples to Georgetown Hospital and send patients also to Georgetown Hospital.
The major problem in the lab is response times from Metatron. And once they would have responded, it's the delayed time that they would ordinarily take to effect repair. And that is what causes a lot of frustration sometimes. And with this area too, the other problem is glucometer strips. We can't do.
Along with dengue.
This needs her lenses here. The ophthalmologist who screens for eye disease, that she uses the ophthalmoscope, will go into her shortly.
What are some of the challenges you have here?
At present, we don't have any challenges right now. It's just that, you come, you get to normalize this. Sometimes patients might behave bad, but I think what eye care needs to be doing, right, is try to open their services in terms of the different things that they do.
When you say patient behaving bad, what do you mean? Because of the time they have to wait?
Not because of the time necessary, the time that they have to wait, like to do a refraction, because I don't only do refraction because I work in conjunction with the doctor as well, right? So sometimes I might be able to do a certain amount of refraction, then I have to do the doctor's patient.
Okay.
When she says the doctor's patients, she's predominantly talking about post-surgery patients, patients who would have gone to Portmont for surgical intervention, and they come back and they need their spectacles.
So how long, we're talking about this patient that is irritable, how long would that patient would have had to wait before he or she starts behaving badly?
Like if they wait like about a half an hour or so.
They get upset?
Yeah.
Yeah, some of them
For
are
free
terrible.
services?
Yes.
Yeah, they get
You'd be
Oh, they should
surprised.
go
Start hearing how much
7
taxes they
hours.
pay, they'll
Okay.
just start using everybody from the president right down, telling me how much taxes they pay.
how
And some
much
of them
money
will
you
show
make
they
and-
don't pay any taxes.
Yeah, I know the story. Well, in that situation, you can't lose your temper.
I don't use them.
But one of the things that is very, when she says doctor, it's the ophthalmologist. What the ophthalmologist does is she screens for eye diseases. And what she does is she checks your eyes for corrective lenses. Right, so that's the difference between the two. Right, one is spectacles, the other one is for eye
What's your name?
diseases.
Monica.
Wonderful.
Adams.
identified for the expansion of our lab. So we're currently engaging the reference lab in Georgetown and GPHC to see what additional services we could inculcate into our existing services.
And this is new.
This is new. This used to be our kitchen.
Okay, and
We've
how much
converted
patients
it.
you have will be coming here?
For malaria microscopy, as a matter of fact, they've been increasing recently because on their way down, instead of going to Georgetown, they stop in here. And quite a number of them come from Region 3. As a matter of fact, even our eye care service is overwhelmed by patrons from Region 3. All our patients, canal numbers 1 and 2 on the West Bank, West Coast, everybody comes to Diamond Hospital. We don't know why, but we don't deny anybody access. It's
So,
in my accountability report
Three,
every month.
it's, you needed to be what?
Tested and installed.
Again, is the
Fire
region?
extinguisher.
Correct. And another thing is, I've been able to get two 38-inch flat screen televisions from courts as part of their corporate responsibility. I've had them for over a year now, and unfortunately I've not been able to get them mounted on the wall because I've been waiting for a little metal casement to put around it to prevent filtering.
How about thinking out of the box? They're the same way corporate citizens have given you the computer.
But we're banned from doing that.
Oh,
We cannot make any request. If somebody comes and they offer to donate, it's fine. But we cannot make a demand of anybody for such things. Who's caught soliciting
so you
bribes,
need to,
donations, they would be dismissed.
what do you call it? You need to,
Two grill casements for vascular, to mount vascular television.
The visit. Yes.
Oh, it's a welcome visit. I believe that these visits should not just take place once a year. It should be quarterly, and I think it will serve a lot of benefit in terms of letting the people know what's going on. And it simply means that we're exercising good governance when we have such visits. All the stakeholders involved know what the challenges are, and they can adequately address them.
The forms that you asked for, you said you were out of the forms for 3 years?
No, 3 months. 3 months.
Do you wait until you run out of the forms before you request?
In the case it was a delay with the procurement process, it wasn't the case that we waited until we ran out of forms. Of course, common sense will tell you differently.
In terms of the theater, is it working good?
The operating theater, yes. For sterility purposes, we cannot take you into the operating theater because you need to have on the requisite gear. The operating theater works 5 days a week. On Mondays and Wednesdays, we do orthopedic surgeries. On Thursdays, we do general surgeries. And on Tuesdays and Fridays, we do obstetrics and gynae cases.
Can you tell us a little about today's visit?
well, yes. As you know, it is a continuation of the visits that are being made by the Social Sector Committee. Unfortunately, we couldn't have had more people here today because they have other engagement. But it is the trend that we have started from Lenore and West Dem, and now we're here at Diamond. Basically, as I've said to that we can give them 80% in terms of if we were to do an evaluation. Many of the issues that have been brought to our attention are issues related to the collaboration between the region in terms of providing the things that are required for the hospitals. So in terms of, let's say, the plumbing, the electricity, all those infrastructural things that are supposed to be done, purchase of things, this is in the purview of the region. And there are some things that are in the purview of the central ministry as well. They lack some personnel, which I think that has to be resolved. Additionally, the ambulance, which is so important to the institution, has not been working. I think it's probably coming to 3 years. It has been in the workshop. This is something that we will urge the ministry or the region to expedite this, because I don't think is the best thing. Security has been also a problem here in the sense that They are members of the public who will come in with their patients, and if things are not done in a timely way, they will threaten the nurses and the doctors and so on. I do believe there is need for a police presence as well, and it was brought to your attention there was an initiative taken by the Ministry of Home Affairs. There is need to expedite that initiative so that the matter can be resolved. From what we have seen, looking at the different sections, as I've said, there seems to be an ample supply of drug, except there is need for strips for those persons with diabetics, so that is in shortage. We saw there's some expired drugs that were donated to the hospital very late, and as a consequence they were unable to utilize them, so that also is another problem. We have made some recommendations to the person in charge, Mr. Manor. They need to have a board in place so that they will be able to look into the management of the hospital. We think a board in place would be useful, and we had proposed maybe somebody from the RDC to person from the NDC, along with businesses, an NGO, either Rotarian or Lions. They can all be invited to participate in this. We think that with a little more proactiveness on the part of the region and the central ministry, I think this can become a very good institution, because it is only 7 years old, and from what was said, 80,000 patients were seen. I think it's quite a lot. We have seen also the turnover in terms of the time that the patients will come in and get their treatment. For example, we were impressed when we went into the pharmacy, and we've seen that all the tablets are already packed and prepared, so that when patients come, all you do, you have a month's supply already prepared in envelopes and there. So that's a kind of initiative. But as I said, we still would like to see some more things being done. The nurses have some problems, and it is not something that can be dealt with in a piecemeal way. Problems such as the uniform allowance, problems such as their meal allowance, and as we know and as we've said to them, they have to take it up with their association, because governments are now in the preparation of budgets, and it is something that you have to start negotiation from now so that it can be incorporated into the budget, you know. So those are some of the...
When will you be back to do another session?
Well, unfortunately, we are now we're approaching a recess, which is from August 10 to October 10. So I think in 3 months' time, that is more than enough. It is more than enough that we have given West Bank, and we have seen the transformation. So we're hoping that within that 3 months, when we come back to visit, we will be able to see much more changes in that regard.
Really good. You visited Lemora, West Lemora, and now Diamond. After the recess, do you have plans to visit more hospitals?
Well, unfortunately, you know, health is not only the only area that we have to deal with. We're thinking there are some hostels when school reopened where the kids are staying that we would want to look at the conditions of some of the hostels under which the children are living. I have had complaints coming out from a few regions about the conditions, and it's something that we want to pursue. So what we will seek to do, if we can have more of our members, remember we're all part-time parliamentarians and full-time jobs. So if we can have more members coming on board, we may be able to divide up with the chairperson with one group and the deputy with another group. And in this way, we will be able to undertake more visits. We're hoping that we can be more proactive, because we feel very good. I think our colleagues who had gone to visit the hospitals and we've seen the transformation, we feel very good about it, that it has borne fruit. And when you are able, it motivates you. So we certainly will try our very best to make some more visits. Okay?